homologous structures in male and the female genitalia. So this is the topic. To start off with a few questions. The urogenital fold. So what are the structures which arises from this? That will be the first question. Next one is in case of the urogenital sinus. What are the structures arising from this? And in case of the paramesonephric duct or the Mullerian duct, what arises from this? So we'll find out the answers in this video. First one is in case of the genital ridge. The structures involve, in case of females, it is the ovary, and in the males, it is the testis. Next, we look at the primordial germ cells. So in case of primordial germ cells, in case of females, it is the ova, and in case of the male, it is the spermatozoa. Then, moving on to the labioscrotal swelling. So in case of the labioscrotal swelling, it includes the labia majora. This is in case of females, and in case of males, it is the scrotum. Then looking at the urogenital folds. So urogenital folds, it is nothing but the labia minora. And this is the females, and in males, it is the ventral aspect of the penis. That is a penile urethra. Then we move on to the genital tubercle. So genital tubercle, in case of the females, it is the glans clitoris. And in case of the males, it is the glans penis. Then looking at the other part of the genital tubercle. So it leads to the vestibular bulbs as well as the corpus cavernosum and the corpus spongiosum. Then we move on to the urogenital sinus. So the urogenital sinus, in females, there is urethral as well as the parurethral glands. The Skene's gland as well as the lower part of the vagina. So this is in case of the females. Now, in case of males, the urogenital sinus, it is the prostate gland. Next, we move on to the urogenital sinus. So here, in females, it is a greater vestibular glands or the Bartholin gland. And in case of the males, it is the bulbourethral gland as well as the Cowper's gland. Then moving on to the sex cords. So sex cords, this involves the granulosa cells. This is in case of females, and in males it is the seminiferous tubules and the Sertoli cells. Next, moving on to the gubernaculum. So in case of gubernaculum, it is the round ligament, the round ligament. This is in case of the females. And in males, it is the gubernaculum testis. Then we move on to the mesonephric tubules. So mesonephric tubules, the females, there is epiphoron and the paraphoron. Next, in case of males, it includes the efferent ductules as well as the paradydymis. Next, in case of the mesonephric duct, so mesonephric duct and the Wolffian duct. So here, in case of females, there is the Gartner's duct. Gartner duct, that is the remnant structure. And now, looking at the structure in males. In males, it is the epididymis, ductus deferens, as well as the ejaculatory duct. Then looking at the paramesonephric duct or the Mullerian duct. So in case of paramesonephric duct or the Mullerian duct, in females, it includes the uterus, the fallopian tube, the cervix, as well as the upper vaginal wall. Same thing in case of males, it involves the prostatic utricle as well as the appendix of testis. That involves the remnant structure. So now moving on to answer the questions we asked in the start. So the first question was, in case of the urogenital folds, what are the structures? So in females, it is nothing but the labia minora. And in the males, it is nothing but the ventral part of the penis, or that is the penile urethra. Next, we asked in case of urogenital sinus, what are the structures? So here, firstly, there is the urethral and the paraurethral gland, or the skin gland, or the lower part of the vagina. So these are in females. In males, it is the prostate gland. This is all arising from the urogenital sinus. So here it is prostate gland. Next, we jump on to the next part. So here in females, there is the greater vestibular glands, the Bartholin's gland. This is in case of the females. In the males, it includes the bulbourethral gland and the Cowper's gland. Now, moving on to the last question. So the last question we asked was, in case of the paramesonephric duct or the Mullerian duct, what are the structures? So in case of the females, it includes the uterus, the fallopian tube, the cervix, as well as the upper vaginal wall. Next, we look at the structures in case of the males. So the paramesonephric duct and the Mullerian duct, it gives rise to the prostate utricle. and the appendix of testis. This is nothing but the remnant structure. Hello everyone, this is Dr. Hub. Now let me tell you our story. Running with us, we are sure you will reach your destination with ease.